Community Hotline is made possible with generous support by Gresham Ford, the dealer with a heart. The Contribute to the Community program provides opportunity for the Gresham Ford team to make a positive impact, serving their customers and helping people across the community. And by the Mount Hood Cable Regulatory Commission. The Mount Hood Cable Regulatory Commission advocates on behalf of the public interest on communications policy issues at the local, state, and federal levels.
Hi, and welcome back to Community Hotline. Thanks for staying with us, because now I have the pleasure of talking with the Oregon Latino Health Coalition, and here to represent is Oscar Sanchez. Welcome.
Well, thank you for having us.
Yes.
I'm really glad that you have cookies outside. I love
You like
cookies.
the cookies,
yes.
huh? Well, you know, we aim to please. So, Oscar, you are the outreach worker for the I'm Healthy Soisano program, correct?
Yes.
Okay, so explain to me first of all about Oregon Latino Health Coalition. What can you just sort of give me in a nutshell what exactly your organization does?
So the Oregon Latino Health Coalition advocates for access to health in the capital, and so we always have a team working in Salem to
advocacy work there.
Yep, to advocate for health equity in the state. The Oregon Latino Health Coalition is a big part of passing CalWIN Plus, which is prenatal care to all women. And currently we have, we're working on passing Cover All Kids, which is giving all kids in the state of Oregon access to OHP.
Which all kids need coverage, right?
Yes, to be able to lead productive lives, be able to be in school and be present, they need to be able to be healthy. So.
Right. So tell me what happens when a child has no health coverage and they get sick. What happens?
So if they get sick, well, Mexican remedies, Latino remedies, you know.
It is a home remedies.
Home remedies, yes. But we have a program, the Soisano I'm Healthy program. What we do is that we're able to give youth access to medical services for free under a voucher program through the safety net clinics. And so our clinic partners are Multnomah County, Wallace Medical Concern, Outside In, the National University of Natural Medicine, and Rosewood Family Health Center, which is on 92nd and Powell.
Yeah, those are some really good partners.
Oh yeah. So
and a few of them are out here, like Rosewood, and then Wallace. And then of course Multnomah County. So if are those vouchers used for the kids as they get sick, or are they used for wellness visits too?
Wellness visits as they get sick. Pretty much when we have a family that we encounter and they need access to medical services, if they qualify for the program, which there's only two qualifying factors, that they're under the age of 19 and that they don't qualify for OHP or QHP for non-economical reasons. So our immigrant community for many nations are able to access this program. And so
that's a great service right there.
Yeah.
What are some reasons that somebody would not qualify for the Oregon Health Plan?
So if they're not born here in the United States, they don't qualify for OHP.
Oh, well, that limits a lot of people then.
There's 17,600 youth in the state of Oregon currently.
How many?
Around 17,600.
Wow.
Yeah.
In what area?
In the whole state.
In just in Oregon?
Yes.
Wow.
Just in Oregon alone.
That's a lot. So I can see where this is important. Then how do people find out about your program, and how do they get involved? I mean, say, somebody is out there and they're going, well, I never heard about that, and my kid doesn't have any health coverage. What do they need to do?
So the beautiful thing of living in Gresham and in Portland is our communities are so tight that we talk to each other a lot. And so that's where I come in. My job is to do outreach for this program. So
to let people know about it.
I let them know. So I'm at whenever I can go to a church event, whenever I can go to a school, parent nights, conference nights, I'm at the parks, I'm at the stores, I'm wherever the community is at, restaurants, and I let them know about the program. And just through letting them know, I ask them, if you know someone, or if you could just do me the favor of letting someone know about this program, and it spreads,
Wow.
So it's been beautiful to see our community our communities really just spread the word on its own, and it makes my job a little easier because I'll go to a church event, I'll interact with 200 people, and then that moves into more people, and so
Right, word of mouth, they just pass it on. I mean, right off the top of my head, I can think of a few people that might qualify for that I don't think probably have coverage, that I can tell them about it. I mean, that's a really huge resource. So so then they find out about it, they contact you, and do they need to go through some big process? Is there a long waiting time?
Not at all, and that's an amazing thing about the program. So my information is always available to the community. As you all see, wherever you have, well, right here with the flyer.
Right, you've got the flyers here that are in Spanish on one side and English on the other. And this is, it's talking about, well, this is the information. So your name and telephone number and email are all right there.
Yes.
Some Healthy helps teens and children connect to free health care services if they do not qualify for Oregon Health Plan, and qualified health plans are under 19 years old. That's pretty simple. That pretty much does it.
And so when they reach out to me, and I get phone calls, the thing about me and my colleague Estela, who also does outreach in Multnomah County, because this is a statewide effort, we work.
Are you the only two who are doing this outreach right now? Oh, okay.
No.
So say that would be a lot of work.
We have a list of amazing partners throughout the whole state that are working on this everywhere in the state of Oregon. And so when they reach out to us, because we work Monday through Sunday almost whenever,
pretty much all the time.
Yeah, whenever we get a call, we're not gonna be like, oh, I'm not gonna answer today. Like, we'll
so
answer.
This isn't just a job to you, is it?
No.
I can tell. I can tell you have a passion for that. This is important to you.
Well, for me personally, like I live in East Portland. I've been living in Rockwood for 7 years now.
Yeah.
And I've always been around community, immigrant community. Whenever I worked somewhere. And so this is really important. And so I know that every community health worker out there under this program, and every community health worker in general, we do this work not because of pay or anything else. Like, we do this because it
needs
matters.
to be done, and you want to make a difference, right?
Yeah.
Right.
Yeah.
And good for you. I mean, we need people like you to. That's what keeps our community going, really.
Yeah.
So is this just for the Latino population?
It's everyone and anyone that doesn't qualify for OHP for non-economical reasons. And so we work with people from Russia. We've worked with people from South America, Africa, Middle East, Europe.
Well, there's how many different? There's like 80 some languages spoken in East County. That's obvious that there's a huge immigrant and refugee population here. So a lot of those people are going to be without insurance probably and don't know how to get it. Yeah.
They don't know about this program, and we're doing the best work that we can to spread the word, and that's why we're here with you all today, as well as hoping to spread the word. But I wanted to answer your question real quick. Is that what happens when they encounter when they contact me? So I schedule a meeting with them, and I can meet the families wherever they feel most comfortable, whether it be at a church, whether it be at their house, whether it be at school, at another organization, at our offices, wherever they feel comfortable. Where we will go and meet with them.
That's great.
And once we meet with them, I introduce them to the program, let them know what all it covers, and I register them right then and there. It literally takes 15, 20 minutes tops. And they're able to, because our partnership with the clinics is to where we just give them a phone call and it's directly given to someone that will answer. So instead of having to wait.
So there's no big middleman and bureaucracy to mess around with. You just cut that out. And so people that are undocumented, they don't need to be afraid to let you know, because it doesn't matter. And
the beautiful thing about this program, we don't ask. Just how we don't ask for documentation status, we also don't ask for proof of address, proof of income.
So you make it easy.
We make it really easy, and we want to make sure that they understand, that the whole community understands that their information is confidential.
Good.
We don't share their information with anybody that is not in our partners, and so.
And the partners and you are there for the kids to keep them healthy.
Yes, and so, like I said, the information stays confidential. We don't share it with other organizations. We don't sell it. We don't share it even with the federal government, because, and even if they were to ask us information, we don't have whether they're documented or not. We don't have their income. We don't have their addresses.
Right. You don't need them? You don't have
Nope,
them?
we don't need them. We don't have them.
Okay, that's good. Now, you mentioned a bill.
Cover All Kids.
Yeah, tell me about that.
Yeah, so I want to tell you, Cover All Kids right now, we're in the last few days of the legislative session. And right now, what Cover All Kids would do is that it would pretty much implement the Soy Sano program, the whole state. So what it does is that it is able to, I'm sorry, I say a lot. It's going to be able to give access to the 17,600 youth in the state of Oregon that don't qualify for OHP. It's going to give them access to OHP. So they'll be able to receive medical services because a lot of the times they go to the doctors when it's too late. So we want to make sure that they
don't have insurance.
Yeah.
Or, so what you're doing now is almost like a Band-Aid sort of to full insurance coverage, but it's a very necessary one because it obviously provides a lot. But if you can get this bill passed, you won't really need this.
Yeah.
Is that right?
Yes.
Okay.
And so we're urging everyone to contact the legislators, and we've made it very easy for our communities to where if they go to our website, and it's just www.orlhc.org/take action, or there's a tab on our website that they can look at. You just submit your address, and what the website does is it finds who your representatives are.
Did you have to put your whole address, or can you just put like your zip code?
You do have to put just your street number and your street name.
Okay.
We don't need to know what apartment you live in or anything like that. And then you just put your zip code.
And they'll tell you who those legislators are. Is that right?
So it figures out who your legislators are.
Nice.
Yeah, it's
which
really,
we should know anyway, but most people don't.
Yeah, no, and they do such amazing work in our capital.
Right, right.
And so once it figures out who they are, you just put your first name, your last name, and your email address, and what city you live in: Portland, Gresham, Fairview, and many other cities throughout the state.
Right.
And then it'll automatically send the email for you.
So saying that you support that bill, that you would like them to pass that.
Yes.
See, you're really good at making things easy for people.
Yeah.
So, and I know we're going to have your website on the screen here, so people will be able to write that down and go to it. I'll be sure to do that too, because I think that's really important. So, have you run into any kind of roadblocks in doing this work, or what kinds of things are challenges for you in this?
There's a lot of fear in our community, and understandably, that there's a lot of fear. That our families.
Why you kept saying we're not going to sell your information, we're not going to give it away, we don't know, right?
Yeah, because and that fear is so valid right now with everything that's going on. So that's been a roadblock to where families are like, I don't know you, I'm not going to talk to you.
Yeah, the trust isn't there yet.
But the thing is that they see us constantly in the community, and so after a while, like a family that 1 month told me like, hey, I don't want to talk to you. A few months later, it's like, hey, you have this program, right?
I saw them at the grocery store. I saw them at the post office. And you're living in, if you're living in that same community, people see you all the time.
Oh yeah, they see me.
Or the churches or wherever you're talking. Yeah, eventually.
Yeah, and like I said, I live in Rockwood, so they see me at the stores. They see me getting food, driving around, and it's I love it.
And then if people learn that trust and then they pass the word on to other people, then that's your best bet for getting the word out there. But it sounds like a great program. Is there anything else that you want us to know about this program that we haven't talked about today before we run out of time?
About the Soy Sano program. Well, I mean, like I said, it offers primary and preventative services for immigrant youth under the age of 19. The services that we provide are physical, dental, mental, behavioral, and vision.
All that. Oh, so it's not just medical. It's so medical, dental. You said vision?
Vision.
Behavioral and mental health?
Mental health services,
wow.
Which is incredible, because my favorite part of this job is when I can take the families to the clinics, in particular the dentists.
Oh, so you actually you do that sometimes?
So my job is so I do the outreach, I register them, and I transport them to their first doctor's appointment.
That's a full meal deal right there.
And I love it, like when you get to see the little kids, they're kids,
Yeah.
When you get to see these kids and they're like, oh, what's this, the dentist? And we have this stigma around dentists, but then they're playing with the tools, they're hugging the doctors, and it's such a great feeling.
End up with a beautiful smile like yours.
Thank you. So we offer all of those services. The mental health services are so important.
Oh my goodness,
Our communities go through so much trauma. coming here, living here. There's a
Can't even imagine.
yeah. So
Can't even imagine.
so that's something that I wanted to know. Also, well, the partners are amazing. The community-based organizations that are out there putting in the work day in and day out. The clinics that are providing the services. It's just an amazing program, and I want the community to know that it's there. We are here as a resource for the community, and everything is confidential, which is it's just like a cherry on top, you know.
I love it. Thank you very much. Thank you very much, Oscar. I appreciate it. And it is a great organization, and you're doing amazing work. So people out there, if you're hearing this, please spread the word. Tell people that might be in need of this. Let them know it's safe, and it's a valuable resource. We want to keep our kids healthy. So check them out on their website. Thank you very much, Oscar.
Thank you.
And thank you very much for watching Community Hotline. We'll see you here next week. I'm Monica Weitzel. Good night.
Hotline is made possible with generous support by Gresham Ford, the dealer with a heart. The Contribute to the Community program provides opportunity for the Gresham Ford team to make a positive impact, serving their customers and helping people across the community. And by the Mount Hood Cable Regulatory Commission. The Mount Hood Cable Regulatory Commission advocates on behalf of the public interest on communications policy issues at the local, state, and federal levels.